all here for the same reason, to better understand our health. And as we go through the session tonight, feel free to type your questions in the chat at any time. We'll be addressing some of them later during our question and answer segment. Now, before I introduce our speaker, let me share this personally. I've had the opportunity to attend Dr. Ben's talks several times, and every single time I walk away learning something new. There is always depth, there is always clarity, and somehow it never feels like it's enough. Because the more you understand the body, the more you realize how much there is still to learn. And that's why tonight's session is something I genuinely look forward to. Our speaker, Dr. Benedict Francis Valdecanas, an orthopedic surgeon specializing in arthroscopy, sports medicine, and spine surgery. He has served as past president of the Philippine Orthopedic Society for Sports Medicine, past vice president of the ASEAN Society for Sports Medicine and Arthroscopy, founding chairman of orthopedics at Cardinal Santos Medical Center, associate professor with the European Council for Aging Research and Education. So tonight, you are learning from someone who not only understands the body clinically, but also knows how to translate that into insight we can actually apply. I invite you to stay present, listen closely, and take what resonates, because sometimes one clear understanding can shift the way we approach our health. So with that, it is my privilege to introduce Dr. Benedict Francis Valdecanas.
Okay, thank you very much, Kat. Is my audio fine? Anyway, everyone can hear me? Okay, so let's start sharing my slides. There you go. And here we are. Okay. Okay, slide visible to everyone.
Yes.
Okay, thank you. So before anything, I'd like to thank again Avita for inviting me to speak on this very interesting topic, very close to my heart. Okay, there. So tonight's conversation will be on the science of aging. Everyone is very interested here because everyone can relate. All of us will age, the rate of which depends on our mindset. So as you will see later, I will explain how this can be even altered, the rate of aging, based on the fact that the body heals itself. So for my disclosures, I have nothing to disclose. A disclaimer, I am not an expert. I do not claim to be an expert on the topic, but this is born of everything that I will be saying tonight will be born of 30 years of experience, both in the surgical and non-surgical intervention of degenerative illnesses or diseases. So if I may begin, okay, so we are all now concerned about the topic of longevity. In fact, this has been the topic of many documentaries across platforms and even talks and lectures and even businesses across the board. So if we're concerned about longevity, it's actually because we all want to live or extend this one life we are gifted with as long as we can. And interestingly enough, when the Human Genome Project ended in the 80s, this Time magazine cover came out because of that research, or born of that research, we were able to find out that the human body was actually designed to live to up to 150 years. And this is because of cell divisions and repair and tissue processes that I will be expounding on as we go on with the conversation. So, as early as the time of Hippocrates, there was 400 BC, aging was already viewed as a disease, meaning lumped all together, the diseases that we see now and diagnosed on ourselves or on our loved ones, aging is practically the main or common denominator, the main factor for that. And this is because the human body ages because our cells, which make up the human body, age as well. So delving deeper, if you remember this diagram is from your grade school handbook or textbook of biology. So all the cells are specialized depending on the function that they are meant for. So you have your brain cells, of course, your liver cells for detoxification, your muscle cells for movement, blood cells for circulation, and your intestinal cells for absorbing everything that we eat, which will also come into fore later. So your cells are not really a haphazard mess or bunch of like these red blood cells in a clot. They are actually specialized and arranged into organs. Now there are about 36 trillion cells. It's not very difficult to imagine that now as our economy goes into the trillions of dollars. So out of these 36 trillion cells, these are all specialized and assign specific functions all over the body. Now, it's also good to note that in our body, there are also 38 trillion bacteria. So we are actually a community in itself of 36 of our trillions of our cells and 38 trillion of bacteria in our gut and uh, distributed elsewhere. So imagine the genetic information in one human body that's made up of 36 trillion cells and 38 trillion, even more, bacteria. They have their own DNA. And all of this are synergistic and symbiotic. So, how does the body heal itself? It repairs itself through what we call human stem cells. We are all born with it, such that when we were babies, we had a lot more, but as we age, these stem cells also diminish by number and by quality. So by the time you reach 80, you already from 1 is to 10,000 cells being stem cells when we were newborn. When we reach the age of 80, we only have 1 out of 10,000. So 1 out of 2 million rather, sorry. So they diminish by number and they diminish by quality or function. Now, why is this so? Because they are used up, depending on how you live your life, they are used up in the process of healing the body and regenerating our cells, tissues, and organs. Now, speaking of regeneration, how does the cell manage to do this? If I may be allowed to become a little bit more technical, cell division has many phases. So it's as you can see on the screen, you have your interphase and then you have your mitosis and cytokinesis phases. The interphase itself is where the cell spends most of its time, particularly in the G0 phase, wherein the cell is at rest and just functioning and performing all its processes for the human body. So G1 is when cellular contents, except for the chromosomes or your DNA, are duplicated. And this takes place in a very slow and programmed manner. The S phase, after all the cellular contents, the cytoplasm in particular, are duplicated and regenerated, the cell now enters into what we call the synthesis phase. This is when or where the cell will now duplicate its DNA material, its genetic material. And all 46 chromosomes are duplicated by the cell in this during this phase of synthesis or S phase. After that, the G2 phase, G stands for growth, by the way, the cell itself checks and double checks that all the duplicated DNA material of good integrity and good quality, and no errors are seen or are found. Once errors are seen, these are immediately corrected before the cell actually goes into division, which is the next phase, which is the mitosis. Mitosis is when the cell divides and becomes two. So that's the phase of cytokinesis. After that, after dividing into two cells or into more cells, which is also called meiosis, when the cell becomes four instead of two, this is very much common in the growing or the developing fetus or the baby. So once the cell divides, that cell then specializes or differentiates into the tissue or organ that needs to be repaired or duplicated. So I expect a lot of questions being asked about this slide. So the cell division continues, becomes one, two, and then four, divides through the cell cycle. Now the interphase is just one part of the cell division process. During the cell cycle, the actual cell cycle, the actual mitosis or cytokinesis, this is further divided into what we call the prophase, where the chromosomes condense and are coiled again, and metaphase, where the chromosomes align at the cell center before they divide, thus distributing equal number of genetic material or equal amount of genetic material into the two daughter cells. Anaphase, where these sister genetic materials separate and move towards separate poles before the actual division of the cell itself. And telophase is when the actual membrane of both the nucleus and the cytoplasm, parts of the cell, are divided and decondense. And then cytokinesis is the actual phase wherein the cells become two. So I hope that was clear. We then proceed now after explaining how the cells divide to repair damaged cells. There is a phase wherein once the genetic material is deemed not healthy, the cell is, instead of dividing, does not re-enter the G1 from G0 and goes to a process known as apoptosis, or defined as programmed cell death. So when a cell is meant or destined for apoptosis, instead of dividing, it starts a process wherein well, short of or lack of better term, it goes into suicide or kills itself. So all these cellular material does not go to waste, actually. So after the cell dies or goes through apoptosis, all the fragments are either recycled or destroyed if they are not usable anymore. So all these cellular material are recycled and used by other cells and goes into the process of the repair. Now, why do cells have to divide or need to divide? When a part of your body gets injured, it becomes inflamed. You get a bump on your arm, it becomes bruised, it hurts, it becomes red. That's because all the cells in your uh, bone marrow, which we call your hematopoietic stem cells, migrate to the injury site or site of injury. And then it starts the inflammatory process wherein the cells are assigned specific functions to heal and immediately attend or address the injury itself. A concrete example for example, you have a cut. You're cooking something in the kitchen, you're chopping onions, and you inadvertently cut the skin of your finger. So the first cells or hematopoietic cells that go into the site are your platelets, which are already circulating. So these platelets have two functions. One is to stop the bleeding, the blood clots, over the incision site or the cut site. And as the platelets are clotting the blood, it also releases all these um, substances you see on the upper right hand of your screen. These are your interleukin 1, interleukin 3, and your tumor necrosis factors. These are all what we call inflammatory mediators. These are chemical substances that the blood cells emit or secrete into the area of the injury. All of these inflammatory mediators have specific functions again. And most of them is to provide the baseline or the groundwork for healing that injured site of the body. Now, the more the body goes into an inflammatory phase, the faster it ages. So this is what we call chronic inflammation, when the body does not have a phase or a period that it is not inflamed at any other part, or at any one part of the body. So this is these are the consequences of a chronically inflamed body. So number one, your stem cells will get exhausted. And then, since you always have the inflammatory mediators circulating in your bloodstream, you have altered intercellular communication. So instead of doing their particular or specific functions in peace, your cells start secreting inflammatory mediators, and this does not stop. It's just a vicious cycle that goes from one phase to the other. This causes a lot of other consequences, like dysbiosis, wherein your gut flora, the good and bad bacteria, become imbalanced. Loss of proteostasis, wherein the proteins which are supposed to be made for hormonal production, for neurotransmitter regeneration, these are all put on the sideline, and the body focuses on the inflammatory process instead. This affects the integrity of your cells, particularly the genetic material. So this is when you get mutations. So mutations are practically um, uh, damage in your genetic material, your DNA. Every time your cells would divide, they're degraded one division after another. And this is what we call the telomere attrition. Telomeres are like the caps on your DNA, which are given out or given off when they have to divide. So the more your cells rapidly divide, the shorter your lifespan becomes, both in the cellular level and in the clinical level. Then, of course, you have epigenetic alterations, disabled macroautophagy, or your immune system is affected, and all of the other consequences of a chronically inflamed human body. This is very common, such that we even have a coined word called inflammaging. The more inflamed your body is, the longer it is inflamed, the earlier aging or the faster aging occurs. So the role of inflammation is actually very, very much proven and heavily uh, uh, present in the process of aging. So if you want to age slower, make sure that your inflammatory processes in the body are in check. So what are this? Anything that needs to be detoxified, anything that needs to be repaired has to be repaired immediately, uh, instead of just pushing you into a chronicity or a long-term inflammatory process. So with apoptosis, or your programmed cell death, this is actually the body's way of maintaining homeostasis or well-balanced health. So apoptosis is there to replace old cells. It strengthens your immune system by tagging cells which are not useful anymore. It gets rid of these not useful cells or damaged cells. It stops the damaged cells from multiplying. So cells that are damaged, if they do not go into apoptosis and they keep dividing, that's how you get tumors and cancers. And basically supports overall balance or homeostasis. That's the term that we use for maintaining your body's health balance. So When your damaged DNA is detected, the cell repairs it immediately right there and then before it is propagated into the daughter cells. So DNA repair in particular is to prevent mutations which cause disease. So prevention of mutation is equal to the prevention of disease. And this makes for the proper functioning of all your cells in the body. Now, this relates or magnifies itself through structure and performance of your body itself. So, among these different factors, nutrition, toxins, immunity, hormones, and the most manifest is the structure or the physical appearance of your body. You start aging faster, you have lines at a much younger age, weakness starts, and of course, general imbalance of the body happens. So among this, the structural is the most evident. And a good example of this, particularly in my practice, is when your joints, particularly for as an example, your knees become degenerated or degraded, which we call degenerative osteoarthritis. Now, frequent injuries into the knees will lead to chronic inflammation, which degrades the joint faster. And you end up with a knee that looks like this. You have denuded cartilage, you have bone spurs which grow in areas wherein there is undue stress. And then on X-ray, you can see more the joint space narrowing. So from something like this, wherein you have a space which represents your cartilage, into something like this. And this becomes more painful as you walk on it. But of course, this can be prevented, as you will see later on. Next is your hormonal integrity. So as we age, we notice or observe that our hormones decline, as you can see on the graph. But in actuality or in reality, it's the hormones declining that leads to our uh, faster aging. So the more unhealthy you are, the faster or the earlier in your age that you uh, start having hormonal decline, and your body starts dysfunctioning and aging much faster. If you notice at the bottom of the graph, melatonin is there. Melatonin is an actual normal hormone that your brain secretes during sleep or in preparation for sleep. So melatonin, like any other hormone, will decline as you age faster. So uh, just to mention that sleep is very, very much important in managing the aging process. So your hormones, these are the ones that your body communicates from one cell to the other. They're they're very important that in building tissue and repairing tissue. They start declining with age by 50 to 80% depending on how you live your life. So the healthier you are, the slower your hormones will start declining. Progesterone, for example, starts to decline at the age of 30. So that's when you notice that your menstruation for the ladies starts becoming or starts changing. Estradiol disappears by age 50 when the ladies enter menopause. Of course, for the men, it's the testosterone that declines, and this can even happen earlier than the women. Men's testosterone declined as early as age 30, 35. So andropause happens at a much gradual rate. So the symptoms uh, associated with andropause are much less noticeable than that experienced by the ladies. Thyroid hormone or your hormone for metabolism starts to decline, both in the sensitivity of your body to the native hormone and the amount of hormone that is produced by your thyroid gland. This is when age 40, when people become what we call subclinical hypothyroid, meaning they have the symptoms of hypothyroidism, even if their thyroid hormones are within normal range if you test in the laboratory. This is a very important change, your insulin output, so the production of your insulin and your body sensitivity to your native insulin decline as early as age 30. So people can start developing diabetes as early as age 30 or even early 30s or late 20s. This is very much dependent on your dietary habits. If your diet is heavy on the carbohydrate side, particularly the simple carbohydrates, then your insulin becomes less and less effective in controlling your blood sugar until such time that your body builds up or develops insulin resistance and you start needing exogenous insulin injections as your doctor would prescribe probably. So that by age 50, we've practically experienced 20 years of hormonal decline. That's by age 50, which is only a third of the number of years that the body was even designed to live. If I were to show this diagram, this is what we call the hormonal cascade. You see on the bottom your estrogens, your testosterone, the sex hormones that are practically the most effective and most important hormones in the body. They're called sex hormones not because they're only responsible for sexual function. They're called sex hormones because they differ in quality and quantity in both sexes. So might as well call them gender hormones, but it means different now. So if you notice on the upper part of the diagram, there is a substance you are very much familiar with, cholesterol. So cholesterol is basically the uh, the the root molecule for production of all hormones in the body, including your neurotransmitters or the hormones of the brain. So that cholesterol is noticeably higher in the elderly, not because you've been eating fat, because excess fat that you eat, you only poop out. It's because your body is trying to maintain a higher level of cholesterol because it needs more and more hormones as you age through your years. I hope that is clear again. Okay. So basically, what is aging? It is the general decrease in body functions. It's when hormones decline that we start aging more rapidly, and enzymes and other substances steadily drop. So it's like nature sending, or the body, your body sending nature a clinical message to the cells saying that this is an old body and you can start to break it down. So this is when degeneration overtakes regeneration or the body's capacity to heal itself or repair itself. So when you talk about regeneration, you want it higher than your degeneration so that you age much, much slower. Regeneration is practically banking on your body's genetic design to heal itself. And this is how we can extend our so-called health span, not only our years, not only the years of our lives, but also the life in our years. Now, when you talk about regeneration, there's so much current therapies now out there. Thank you to stem cell research. So this is actually from cellular to molecular therapies. You have your hyperbaric oxygen therapy. I'm sure everyone is familiar with that. You hear it from your friends who are doing it. You see it in on advertisements. You also have your what you call your platelet-rich plasma, which is when the doctor extracts your blood, concentrates the platelets by spinning it in a centrifuge, and the platelets is then injected into an area of chronically inflamed injury. So that will uh, give your body a head start in treating an injury that has been long-standing, which your body itself cannot heal by itself. You have your exosomes, which are practically the contents of your platelets as cells. These exosomes contain all the healing proteins called peptides, your growth factors. And then, of course, there's also stem cells, which is very popular now and much, much widely abused, both in terminology and in practice. And lastly, but not the least, supplementation, which is actually available to anyone and everyone who wants to boost their regenerative capacity. This is practically supplying your body what it needs to repair itself. So like I mentioned, exosomes are that part of the cell which goes out into the bloodstream or towards the injured part of your body, and they contain the proteins, the red bundles that you see on the upper right hand of your screen. These peptides are actually the healing factors or the growth factors that your body needs to start and complete repairing itself from any injury. So that being said, aside from all these regenerative therapies, what can we do as a normal, everyday, busy human being that does not entail much finances or much expenses that we can do on a daily basis? Okay, so like we said, you start aging faster when you keep repairing stuff in your body. So to minimize the amount of repair that your body needs to go through, we should keep ourselves healthy, free from the insults that we put on it, both environmentally and nutritionally. And of course, that includes all the stresses and all kinds of stresses. So let's start first with what you can do to preserve your body's structure. One is regular exercise. And when I say regular, you I do mean preferably daily. So if you ask doctors who tell you to exercise, how regular should exercise be, they'll usually tell you 3 to 4 times a week. But there's an advantage for doing it daily, out of lesser intensity, of course, because your body is a creature of habit. So the results are more immediate. You can appreciate it better, and you keep the body healthier by constantly moving. The body was designed to move, uh, beginning from the prehistoric era when we had to run from predators. But now we are more sedentary. That's why we age faster. It's actually the lack of activity. So when you talk about exercise, all good exercise programs are composed of 3 parts. Number one is stretching. So before and after exercising, you should stretch. Stretching can be 5 to 10 minutes. It's that quick as long as you address particularly the tight parts of your body. Um, Stretching before the exercise prevents injuries. Stretching after the exercise prevents soreness so that you can exercise again the following day. Second important component of an exercise program is cardiovascular. This is any exercise that increases your heart rate and trains your body to a healthier cardiopulmonary function. Cardiovascular exercises, as recommended by the American Heart Association, should be 30 to 60 minutes of your target heart rate. You can compute your target heart rate uh, by subtracting your age from a constant of 220, thereby getting your maximal heart rate, and then uh, getting the 80% of that as your target heart rate. So when you do treadmill walking or running, when you do stationary bicycling, when you do your elliptical, monitor your heart rate that you achieve at least 80% of your maximal heart rate. And lastly, last component of a good exercise program is resistance exercises. Resistance exercises is when you lift weights, be it barbells or dumbbells or kettlebells, or just your body weight, like push-ups and pull-ups. So resistance maintains the tone of your muscles, which is very important in maintaining the manufacture of hormones. Next thing you can do is check your diet. Is it a well-balanced diet? But nowadays, after 30 years of seeing patients and talking about diet, I tend to believe there's no such thing as a well-balanced diet. Maybe we would better call it a well-curated diet. So in reviewing your diet, look at it. There are only 3 macronutrients that you have to check. Number one would be your carbohydrates, your carbs, or sugars, your proteins, and your fats. Usually, proteins and fats are associated together. Carbs are of 2 kinds. complex and simple. Simple carbs being your easily digested, easily metabolized type of carbohydrates, your rice, your bread, your pasta, such that they are so easily metabolized that you end up with a lot of excesses, especially if you do eat a lot of simple carbohydrates. Of all these macronutrients, the body only stores excess carbohydrates. Excess protein you pee out, given you have a healthy kidney function, and excess fats you poop out, given you have a healthy biliary and liver system. Carbs, however, if it excess, your body converts it in your liver to storage fat. So that's where you get your LDLs, your triglycerides. If they are going up, then check your carbohydrate intake in your diet. So here are some tips to manage your diet. We cannot get away from counting our calories. So do count your calories, and this is very much associated with the size of your meal, the amount of food that you eat. Number one, use a smaller plate. So this will definitely limit your caloric intake in terms of food. Second, use your plate to manage your macronutrients. So divide your plate into threes. Uh, most nutrition courses teach us to keep the 50% of that plate for carbohydrates. So preferably complex carbs. You have your vegetables, you have your fruits, you have your root crops. Those are your complex carbs. Try to keep that plate uh, clear of your simple carbs, your rice, your bread, your pasta, your noodles. And then a third of that plate should be your fats and your protein, which I said are usually associated with each other. So an example of this would be um, the steak, and instead of eating rice, steak with potatoes. That keeps your carbs in the complex category. So these are examples of food plate balance. If you want to lose weight, lessen your calories. If you want to maintain, this is a suggestion. And if you want to increase your weight, then of course you have to divide your macronutrients accordingly as well. So why do we need to supplement? Okay. Well, one, because not everything that the body needs to heal itself we get from our diet, no matter how well curated you think it is. So we need supplements to supply the body of everything that it needs to keep those cells healthy, to help the cells repair its damaged DNA, and to minimize division of your cells, and thus slowing down aging. So when you talk about supplements, you usually can get or take multivitamins or specifically certain vitamins that you think with the help of your doctor that you particularly need. There can be vitamin B's on top of your multivitamins. There can be vitamin D's and calcium for the ladies who are entering menopause to avoid osteoporosis. So those are just examples. Now, if you're under a lot of stress, which most of us are, then choose a vitamin or a supplement that contains a lot of nucleotides. Nucleotides in particular are the ones that or the substances that your body needs to repair your DNA. And through my experience in recommending supplements, there's still one that I've found that has a lot of these nucleotides to help the cells repair itself, its DNA, before dividing into apoptosis, for example. So Celergen actually has your uh, bio-DNA cell matrix. It's very natural from deep sea marine fish. It's biocompatible, easily absorbed in the body. It's very potent, as a lot of you probably have experienced already, and it's very safe. I have yet to see a side effect of taking the supplements for long term. So to deal with each and every major component of this supplement, you have your hydro-MN peptide or your peptide N. The effects are, one, they're proven to reduce the dietary glycemic index, meaning, as you see in this graph, your peptide N can really lower the reaction of your blood sugar uh, as early as 50 minutes after a meal. So it increases, in other words, it increases your cells' sensitivity to your native insulin by lowering the apparent glycemic index of the food that you take in. And the highest glycemic index food substances are again your simple carbohydrates. So this aids in maintaining a healthy body weight and reducing the risk of obesity, of course, which is very much common now, particularly in the Philippines. We are number two in both the rate of diabetes and obesity, second only to China, in Asia at least. So this prevents you or keeps you from developing type 2 diabetes, provided you also fix your diet. Next, you have your peptide E, which is a collagen component. This not only affects the collagen in your joints, but also the collagen in your skin. So again, this is the only supplement that I've seen which affects both types of collagens. Most collagen peptides out in the market would either address cartilage in the joints or just the skin being manifest, less wrinkles, so to speak. So peptide E collagen is an anti-arthritic agent against progressive destruction of your joint cartilage. If you want to slow down the degradation of your knee cartilage, for example, as you saw in the example earlier, then this can help. It helps prevent damage to the synovial membrane or the the joint membrane due to chronic inflammatory process, which we call synovitis. If your knees are always stressed because of your heavier weight, then you have chronic synovitis, which is an inflammatory process that again can slow down or minimize the function of your knees over age. Next, we have the effect of peptide E collagen in the formation of your cancellous bone. This is very important and quite significant in people who are already in their menopausal age group. So osteoporosis is a very common condition that we see in this age group. So peptide E can help, but of course you have to take calcitonin, and cholecalciferol or vitamin D. And when you take these additional supplements, they have to be in the proper dose. Calcium is recommended at 1,200 milligrams per day, while vitamin D is now recommended at 5,000 units instead of the usual belief of 400 to 800. Now, peptide E collagen also maintains the skin's hydration, such as you can see on this graph. With 3 months of use of Celergen, the base hydration of your skin increases by 10% already. And this was shown in a study of 44 subjects, all of whom are above the age of 40. This helps in reversing the loosening or the relaxation of your collagen fibers. We get wrinkles because our collagen in the skin become looser. So this helps in the maintenance of dermal collagen for the toning and the lift. So for those who are already using Celergen, if you are enjoying the compliment of your friends saying that there's something different about you, then you can thank peptide E collagen for that. Now, last but not the least, the cellular effects of your biocellular matrix. This is actually a study done in 2013. It's a landmark study which shows how effective uh, biocell matrix is or complex is in preventing your body into degenerating into tumors or cancers. Like I said, your cells that do not go into apoptosis when they should already, because they have a damaged DNA or genetic material, uh, they become cancerous or tumorigenic. So this is a study which looked at hep G2 cell proliferation in vitro in the petri dish. So what they did was apply Celergen's active ingredients on hep G2 cells, which are cancerous cells, And this graph showed the effect of a 73% reduction in the propagation or proliferation of these cells. This graph showed that with the help of this supplement, the apoptosis of the HepG2 cells increased. So cells which are dividing with the damaged DNA, they went into the apoptotic process when applied biocell complex. This shows 3 to 4 times increase in the activity of your P21 protein. P21 protein, or actually P21 is a gene which prevents formation of cancer cells, or prevents or pushes your cell into apoptosis if it has a damaged genetic material already. So 3 to 4 times increased activity of your anti-cancer gene P21. And then GAD 153 is actually a gene which also prevents the proliferation of damaged cells. So there's a 12 times increase in the activity of your GAD 153 gene as early as 48 hours. And then your oncogene is actually, as we always say, all of us have genetic code for cancer. CMYC is the most common gene for, as we call, oncogene or oncogenic gene. This is a genetic code in your base DNA that, if manifested or stimulated, it will cause the formation of cancer in any cell that it is activated in. If it's a liver cell, you develop hepatocarcinoma. So this study showed a 40% reduction in the activity of your oncogene CMYC or CMYC. This is a more recent study which focused on the P21 gene, and it increased activity of that gene, especially in a genetic strand that is damaged. It needs all the nutrients and supplements to supply the nucleotides with which your DNA or your genetic material uses to repair itself. There, your P21. Okay, so why are we so concerned about that? Not only because we aim to lengthen our health span, it is a actual fact that globally the number of 100-year-olds or centenarians is expected to increase tenfold over the next 35 years. So we are hoping that we are one of these people. So aside from being blessed with a genetic material that is helpful for healthy aging, a centenarian is somebody who balances all these factors very well. So you have your diet and your genetics. Particularly, as you can see, the diet is a very big part of that equation. Genetics can only manifest up to 20% of your life if your lifestyle is good. And then you have your environment, and then, of course, more importantly, you have to put exercise and supplements into your lifestyle. I think this is my last slide. Okay, so thank you. So I give the floor back to Kat, who will now manage our Q&A.
Thank you. Thank you very much, Dr. Ben, for that very insightful and valuable sharing. So if we take a moment to reflect on what we heard tonight, aging is not just about time. It is about what happens at the cellular level, and more importantly, there are ways to support the body's natural ability to repair and regenerate. So for many, this is where the shift begins, from simply reacting to health concerns to becoming more intentional about prevention and long-term vitality. So at this point, we'll open the room for a few questions. If you've placed your questions in the chat, we'll go through some of them now. You may also raise your hands if you'd like to ask directly. Okay, so let me just check. Okay, so our first question, Doc, from the chat. With insulin resistance being very prevalent, especially with type 2 diabetes, what actually happens to the body at the cellular level, and how can Celergen support the body in managing this?
Okay, so first let's lay the groundwork for how diabetes develops. Okay, diabetes develops, or the acquired type of diabetes, diabetes type 2, develops when your body is exposed to so much sugars or carbohydrates that your insulin become ineffective in controlling it already. So there is a phase where your doctors will call you pre-diabetic, meaning regardless of what you do, your blood sugar is always in the higher ranges when you do your blood test. Pre-diabetic is more specifically referred to as what we call metabolic syndrome. Metabolic syndrome is an umbrella entity that covers including insulin resistance. Insulin resistance develops when your body is always exposed to high levels of blood sugar, that your insulin has to be produced more and more. So it loses its effectivity because your body always is exposed to high levels of blood sugar. You have to remember that sugar, when you eat it, when you ingest it, so it's absorbed in your stomach. The stomach is the only macronutrient the stomach digests is carbohydrates. That's why you have acid there. So incidentally, if you are suffering from hyperacidity or reflux, then look at your diet. It's mostly carbohydrates. So if you eat a lot of carbohydrates or sugar, your body has to produce more and more insulin to control your blood sugar. How does it do this? Insulin will unlock your cells so it can absorb the sugar that you take in. More and more sugar will grow will cause your pancreas, the organ that produces insulin, to go into fatigue. So this is very similar to what we call adrenal fatigue, wherein you are always stressed and your adrenals start producing less and less cortisol because its effectivity decreases. With insulin, it's the other way around. Your pancreas starts producing more and more insulin to control that ever high blood sugar that you expose your body to. So eventually your pancreas gets tired, you start you stop producing native insulin, and you are now dependent on insulin from the outside, which we call exogenous insulin. So you start injecting yourself with insulin. Fortunately, all of these things are preventable and reversible. So again, you keep hearing me say too much carbohydrates, too much sugars, then lessen your intake of carbohydrates, lessen your intake of sugars.
Okay,
I
thank
hope
you.
that answers the question.
Yes, Doc. We have more questions. Next question, Doc. If hormonal decline is merely a manifestation of aging and hormone replacement does not alter the aging process, where does cell therapy fit in?
Okay, very good question. First off, let's correct. The proper kind of hormone replacement therapy should benefit and alter your rate of aging. Okay? The body ages faster when your hormones decline faster. So if you can top up your hormones by applying bioidentical creams, by injecting testosterone, so the proper kind of hormone replacement therapy can slow down aging. Okay? So cellular therapy, particularly with a supplement that helps your cells repair themselves, the first effect, incidentally, is you will notice your hormones become rebalanced. So for people who have been taking Celergen or the like supplements, unfortunately, there's no like supplement to Celergen, like I mentioned. Your cells start preserving themselves. And if your cells are getting more and more preserved as you age, your hormones go back to its normal function. You cannot do away, of course, with menopause. It's menopause and andropause happens because of the relative decline of your hormones. But at least you can maintain your hormone to a functional level or at a functional level wherein your hormones are always balanced. They're always adequate to provide whatever the cells need to power themselves to do your functions, your daily functions. So making sure that your hormones are properly balanced, not only at the right level or the right physiologic level, can really slow down aging. And that is actually at the cellular level. So yes, consult your doctor regarding hormone replacement therapy.
Okay. Thank you, Doc, for that. Okay, a question from Dory Apacible. After Ori left patella surgery, taking 3-Genacol collagen capsules before bedtime was prescribed. Will taking one Celergen capsule daily suffice for the speedy and full recovery of the Arif left patella surgery?
Okay, very good question. Let me start by saying or explaining ORIF means open reduction internal fixation. So uh, Dory injured her knee by fracturing or breaking her kneecap, the patella. And what that entails is a damage on the underlying cartilage. And damaging your underlying cartilage hastens degenerative osteoarthritis. It's, in fact, we call it post-traumatic arthritis. Okay. Usually, you are recommended to take collagen peptides, which is Genacol, which she mentioned, and the right dose is 3 capsules at bedtime. It's because when we sleep, that's when the body repairs itself. So you are providing, by taking Genacol at bedtime, you are providing your body with the raw material to regenerate your cartilage, especially if it was unduly or unexpectedly damaged or fractured with your patella. Uh, Unfortunately, it cannot compare to Celergen. They have different mechanisms of action. Celergen helps your cells repair its DNA and helps your collagen function better, but you have to have the collagen first for Celergen to take effect. Uh, is that clear enough? So, if you're asking whether you should take one or the other, I would recommend that you take both. Okay? Taking Genacol provides the raw material for cartilage regeneration. Taking Celergen makes sure that your body produces enough cartilage or goes through the process of regeneration more effectively. I hope that answers Dory's question.
Thank you, Doc. Another question, Doc, from Yunting. Can Celergen help with spinocerebellar ataxia? Understand that it's an inherited neurodegenerative disorder.
Okay. All diseases have a genetic or inherited factor. So we develop, for example, ataxia because we are prone to it genetically, but we also provided all the setup or setting for your brain to malfunction. Ataxia is when your motor functions become uncoordinated. Okay. So what your body is trying to do now that it has developed this illness or disease is to repair your nerve cells, particularly your brain, your motor cortex. Celergen can help. Okay. All diseases are multifactorial. There's genetics, there's environment. Celergen can help your cells repair themselves. Did that answer the question? It will not cure you of ataxia by itself, but you have to correct all the other factors and provide your body with what it needs to repair your nerve cells, your brain cells.
All right. Thank you, Doc. Next question. I have heard of oral cell therapy that is extracted from animal placenta. Are these effective and how does it compare to Celergen?
Okay, there is no such thing as oral cell therapy because cells, when you take them, which these products claim, they will just get digested and broken down into base proteins. So what Celergen offers is it provides the raw materials that your cells need in repairing your cells. Okay, so taking deer placenta, for example, is not taking stem cells. It's not taking any cellular therapy. And what you are benefiting from at the most is that you have the peptides that these cells contain that are placed in a capsule. These peptides are from placenta, which is a developing organ, and thus are rich in growth factors. So that's what you're getting.
Another question, Doc. I recently been told to have osteoporosis with negative 2.6. I am male, 65, Asian. Is Celergen able to help? How long will it take to see results?
Okay, it's quite rare for a male to get osteoporosis. Yes, negative 2.6 is osteoporotic already. The negative 2.6 is a score. It's practically the T-score, which is a measure of standard deviation from the norm. So you are negative 2.6 away from the normal Asian 65-year-old. Uh, the passing is negative 2.5. So you're just barely there. So first you have to find out why you are osteoporotic. Like I said, it's rare for men. It's very common in women, particularly osteoporotic women, because bone metabolism in women is heavily dependent on estrogen, which they lose when they go into menopause. For men, we never stop producing testosterone, which is also important in bone and muscle metabolism. So there must be something that is causing you to become osteoporotic, which may need to be corrected. One of the most common causes for my osteoporotic men is nutritional deficiency. So you might not be getting enough calcium. You might be getting enough calcium, but your body is not absorbing it. You might be getting enough calcium and your body absorbing it, but it's not going into the bones. So all of these things are metabolic processes that, yes, Celergen can help correct.
What about arthritis, Doc? How can Celergen help?
Okay, arthritis is a general term for any inflammation of the joint. Arthros is Latin for joint, itis is inflammation, suffix for inflammation. So there you have dermatitis, you have neuritis, which are inflammatory conditions. Arthritis is, again, like any disease, a multifactorial in origin. So developing early arthritis, you might be overweight, you might be inflammatory with what you eat. There is such a thing as an inflammatory diet. And across the board, most people get inflammation from their diet if they have a lot of gluten and dairy in their diet. So you might have to look at these things. So uh, all diseases being a multifactorial condition, the major factors that influence the development of a disease is diet. It's usually genetic and environmental with all diseases, and that part of the environment which has the most impact on our bodies is one that we put inside it. So that's your food. So check your diet, check your weight, check your metabolism. Arthritis, again, is the failure of the body to heal itself. So pushing the body to heal itself, supplements do help.
Thank you, Doc. Next question. Okay, so someone suffering from sciatica, would Celergen be of help to manage the condition?
Okay, again, like any disease, multifactorial, there are a lot of factors which lead to the development of sciatica. Sciatica is most commonly due to compression of a nerve root in your lumbosacral spine. It's either your disc, your bone spurs, or both. But this develops because your back is being exposed to stresses it is not conditioned for. So by saying that, the only thing that can condition your lower back is exercise. And the stress that you have to minimize that you expose your lower back to is your weight. So you have to look at these things again together with supplement. Yes, it can help.
Keep up. Next question, Doc. What age can one start to take Celergen to help the body?
Okay, the body practically starts degenerating at the age of 25. So this is not a hard and fast starting line. You may start degenerating a part or many parts of your body even while you are developing or in the developmental stage of musculoskeletal development. So this is not a hard and fast starting line. So you can start taking Celergen or any supplement for that matter as you go towards the tail end of your developmental phase, which is your later teens.
Next, Doc, does Celergen have any effects on pulmonary hypertension, especially in the late stage? If yes, how does this take place?
You'd be surprised Celergen can help the body recover from such injuries and insults. Pulmonary hypertension has an underlying cause. Usually it's pulmonary damage, usually it's heart damage, which is we call cor pulmonale, wherein you have a heart disease because you have high pulmonary circulatory pressure. So you have to identify first what caused the pulmonary hypertension, and then you correct it from there. Okay, that's a problem that we see now in our doctors. They we were all trained to cure or treat symptoms. You have pulmonary hypertension, we give you decongestants, we give you blood vessel relaxers or relaxants. But the main reason why you develop pulmonary hypertension is not addressed. So go to a more conscientious doctor who will investigate why you develop your symptoms and what you're feeling and discuss with him or her how you can treat the underlying cause of your ailment and not just the symptoms.
Thank you, Doc. From Miss Irene Lim, how does Celergen help a lupus patient who is on several medications at the moment to help manage the condition?
Okay, lupus is basically an autoimmune disease, and one of the highest turnover rate of your cells are your blood cells and your immune system. So fixing your supplementations, your diet, your lifestyle will immediately and heavily impact on your immune system. If you have a well-balanced immune system, there's no underlying cause putting this system into imbalance, then your lupus will also correct itself. Yeah. Again, if you notice, all the meds that are given to you are band-aid solutions. We give autoimmune disease patients steroids to dampen their immune response. It's like chemotherapy. You're not only killing the cancer, you're also killing the good cells. So by suppressing the immune response of the body, you take it further and further from normal functioning and balance. So yes, supplements can help. The reason why you are suffering from an autoimmune condition such as lupus is because you have an immune imbalance.
Thank you po. Can Celergen help with progressive supranuclear palsy?
Okay. Like all the diseases that we discussed today or tonight, this is a multifactorial thing. You have to find out and address what caused your palsy. Okay. Usually, and this is something that a lot of doctors don't even look into. It's your medication which pushed you into that condition. So there are practically most diseases can be addressed by fixing your lifestyle so that you won't need medications, all of which have side effects that can cause another illness or another condition.
Okay po. Next, can Celergen be given as an alternative solution for elderly patients who does not want invasive surgery for arthritis or arthrosis?
It depends on the stage of arthritis. On the X-ray, we have a four-stage grading system. initiated by Kelgan and Lawrence. Stage one is when um, your knee, for example, your joint starts forming osteophytes or spurs, bone spurs. Two is when there is already a decrease in the blank space in your X-ray, which represents your cartilage, meaning there's already thinning of your cartilage. Stage three is when you have both a lot of bone spurs and decreased space. And stage four is when the space is completely obliterated and you have bone-to-bone contact of the joint. So it depends when you catch the arthritis. Most arthritic conditions become symptomatic or become painful when they are from grade 2 to grade 3. So if you catch them early enough, yes, you can help your body regenerate cartilage, provided you correct all the other factors. And most common of these is your weight. So if your patient is already for surgery for arthritis, that means he or she is already grade 4. And no, sadly, Celergen uh, will not help regenerate that cartilage, which is non-existent anymore. What Celergen can help with is the inflammatory process, which that can cause, which is also the underlying reason for the pain. So yes, the patient can feel better with Celergen, even with a grade 4 arthritis, but he or she still needs to address the other factors and maybe even have the surgery.
Thank you, Doc. Can you give Celergen to people with chronic kidney disease and what dosage?
Okay. Uh, it's safe for CKD patients, chronic kidney disease patients, to take supplements as long as your creatinine is within monitoring range. That means your nephrologist is watching your creatinine very closely. So when you start taking a supplement and your creatinine goes up, there's a trend that it's going up, then you have to back up. But you can start safely with the usual dose of once a day of Celergen. Yeah.
Okay, so how can you explain after taking Celergen, patients experience sleepiness, muscle pain, or stomach pain on her or his first 6 days on Celergen, sometimes even palpitations, and they have no issues on either gastro or heart prior to taking Celergen?
Okay, like any substance that you take in, it's not only the active ingredients you're taking in, you're also taking excipients, you're also taking vehicles with which the vitamin or the supplement was manufactured uh, for or on. So uh, you can react to these other components, but the components that we mentioned as being the main ingredients of Celergen, they're practically safe. Like I said, having been prescribing Celergen for the past 15 years, I still have to see uh, a side effect that can really cause me to withhold it from my patients. Now, if you experience hyperacidity maybe or palpitations, which can also be caused by hyperacidity, then observe it over a week's time. So I hopefully after the sixth or seventh day of taking Celergen, this will all quiet down. That's just your body adjusting to this new substance that you're giving it. But if it doesn't improve or doesn't go away, in fact, if it gets worse as the days go on after the sixth or seventh day, then yes, you may have to discontinue taking it.
Okay, so we'll go to our last 5 questions. Okay, we have, I'm just checking though. Okay, so here, my friend is suffering from detrimental effects after his third job of mRNA COVID vaccine. Lack of energy, heart issues, emotional disturbance. Do you think Celergen can help in this case?
Okay, there's much to learn about our mRNA vaccines. Yes, it's true that we've been seeing a lot of new conditions in our patients who underwent uh, at least 3 or 5 vaccinations of mRNA. The problem is we don't fully understand what its effect is on our cells. Being an mRNA based substance or agent, we're not really very sure that it has no effect on our own genetic material. Your mRNA or your messenger RNA is the bridge between your genetic code, your DNA, and the protein making machinery of your cells, the ones that produce exosomes and even your hormones. So the effect of mRNA may have an effect on the manifestation or the translation of your genetic material in a way that was not there before you had the vaccine. So, number one, you have to look at the other factors first that we know, that we understand, before starting to blame the mRNA vaccine. Yeah.
Thank you, Doc. Next question is, can Celergen help in stroke recovery? And if yes, how many should they be taking?
Okay. If you have an illness across the board, we recommend 2 or 3 times a day of Celergen. And this is because we need to push your regenerative capacity ahead of your degenerative capacity. And yes, stroke is a process that entails degeneration, not only of your blood vessels, but also of your brain tissue, which suffer the lack of oxygen because of the blockage or the bleed. So if you are recovering from a stroke or any illness or disease for that matter, then we recommend double dosing or triple dosing on your Celergen.
Okay, so will Celergen help with early onset of Parkinson's disease as well as ADHD, autism, mental health concerns?
Okay, so Parkinson's and all the other neurodegenerative diseases is caused by your brain not being able to repair the damage that it's undergoing. So considering that the basis of the action of Celergen is to help your cells repair themselves, then yes, it can help with neurodegenerative diseases, particularly early onset or early diagnosed or newly diagnosed neurodegenerative diseases. So this includes Alzheimer's, this includes Parkinson's, or even transient ischemia or transient strokes.
Okay, so down to last 2 questions, Doc. When is the best time to start Celergen? Is it too late after problems start?
Okay, the body repairs itself as long as we are alive, we're living and breathing. So it's never too late to fix your lifestyle. Okay, and of the major things that we can fix in our lifestyle: exercise, diet, and supplementation. Yes, supplementation can be very much started by taking Celergen. Yeah. If you want if I may share my personal protocol or experience, I take Celergen as my multivitamin or my base vitamin. And then if I need to, like maybe I notice some vitamin B deficiency, particularly for neuronal function, then I take vitamin B on top of Celergen. And if I have issues with my immune system, I take vitamin C and vitamin E and zinc on top of my Celergen. So that's how I manage myself, my supplementation protocol, and which is what I recommend to my patients. Well, another example would be if you're osteoporotic, Celergen is your base multivitamin or vitamin, but you have to take calcium and vitamin D on top of that.
Right. Okay, so with that, we no more. Okay, so hold on, Doc. Okay, some of the
Well,
questions.
most of the concerns were either autoimmune diseases or diseases of the immune system, and neurodegenerative diseases, which is a disease of the brain and central nervous system. So these diseases develop because your body is unable to repair itself. So it's always a race between degeneration and regeneration. When you start developing diseases, that just means that your degenerative processes are overtaking your body's capacity to repair itself, or your regenerative capacity. So look at things that way, and you would be guided on what to do in terms of lifestyle modification, supplementation. So that's probably what I can leave you with.
Thank you, Doc, for patiently answering all the questions, and thank you for those thoughtful questions. Okay. So if tonight's session sparked your interest and you would like to understand more about the products discussed, we encourage you to connect with the person who invited you. They will be able to guide you based on your specific needs.